Here we go. Welcome, everybody, to another episode of The Big Idea. I am your host, Dr. Jeffrey Hanna, where we have a look at the big idea. It's how a little area here at the very base where your head meets your neck can actually have very big implications in terms of your health, well-being, your ability to enjoy life in ways that you would never think are actually associated with that particular little area. And today we're going to be having a conversation as it relates to something that's known as a Chiari malformation. And we're going to be showcasing a case who we took care of a few years ago who had a Chiari malformation but didn't realize that there was another way until we started care for her. So, first and foremost, what is a Chiari malformation if you've never heard of it? Well, what it is it is a condition, if you would, where your brain, which normally should be sitting inside of your skull, starts to descend just a wee little bit outside of the skull and into the upper part of the neck right here, producing constriction, pressure, things like that. And I will oftentimes use the analogy of a balloon with a piece of string attached. So if you imagine the balloon is your brain, the string is your spinal cord. And you can imagine it's supposed to be sitting inside of the skull like this. But if you take the string and you start pulling it from the bottom, what's going to happen to the bottom of the balloon? Well, the bottom of the balloon, it's going to start to bulge down into the narrow space from the skull into your spinal canal. And what that's going to be like is like trying to fit your foot into a shoe that's unfortunately two sizes too small for you. Yeah, you can probably do it, but it's not going to be very comfortable. And what that's going to lead to then is that can lead to where you've got little bits of microcompression, or at the very least constriction of the normal fluid that should be circulating in and around that area, and that can lead to a whole variety of symptoms. Headaches, migraines, dizziness, vertigo, brain fog, memory issues, full body fatigue, balance and coordination, all kinds of different things like that. So it's not a very nice condition to have in the first place. And from a traditional medical standpoint, there's a couple of things that go with it. One is that they say there's really nothing that we can do about it, only either A, take drugs to mask the symptoms, or B, have what's called a decompression surgery. And that's where they literally take a little bit of the bone off the back of the skull, take a little bit of bone out of the top vertebrae in the neck. The idea being kind of like if your foot is fitting into that too tight a shoe, if you can't get a bigger shoe, cut a hole in the side of it so that at least your foot can bulge out and it's not producing as much stress and pressure. But of course, a lot of people, they don't want to do that. They want to know, okay, well, what other natural options might exist? And this then relates to a couple of things that are important to understand about what a Chiari malformation is, isn't, but also what you can do about it. So firstly, I'm going to start with what you can't do about it. Oftentimes, why does this happen in the first place? Well, it's because as we are born and as we're growing up, our skull is supposed to be continuously expanding and changing its shape. If unfortunately we've had an injury or something has happened developmentally when we were very, very young, and instead of your skull continuously expanding, what it does is it locks like this prematurely. It means then that as your brain and your neurology continue to expand, there's not the space. Your skull is not expanding with it. And as a consequence of that, it's got nowhere to go except for down. Now, if this happens, we can't really change the shape of your skull. And that's a tricky thing. It means that your normal margin of error for these kinds of things is unfortunately way, way less. But in the same breath, there's a little bit more to the story than meets the eye there. And we know this because a lot of times people, when they discover that they have a Chiari malformation, it's actually an incidental finding. That is, they're having a brain MRI or a neck MRI for some other reason, and they discover that that condition has been there for years, months, decades, not necessarily producing any symptoms. My point is just because you might have a Chiari malformation does not guarantee that there's going to be a problem. Instead, we need to understand that it is a risk factor. Again, your margin of error is much, much less. And what that also suggests then is that it often takes a catalyst or some other factor to produce the symptoms that we associate with the Chiari malformation. And this is where there may be an opportunity to help people without drugs, without surgery. I'm going to go back for a sec so that I can describe for you that analogy again of the balloon with the string, okay? So the vertebrae in your neck, they actually have anchors or tethers that normally protect your brainstem and your spinal cord. They allow it to be able to have a certain degree of flexibility. The kicker is if you have had a whiplash injury of some kind, and it doesn't have to be a car accident, it's anything where your head and your neck go snap like that, back and forward or side to side. So that can be a trip, a slip, a fall, a bike fall, any number of different things, roller coasters. Even if you land on your shoulder, if your neck then continues a little bit, even if you don't hit your head, there can be a, quote, knock-on effect there, where what it can do is it can produce a soft tissue strain injury where things maybe aren't broken, maybe aren't dislocated, and aren't unstable either, but they can shift, lock out, and there they persist over days, weeks, months, years, decades, slowly accumulating stress, slowly reducing your body's resilience, its ability to adapt. And the consequence is that these things can accumulate, and what we put down to as being, it's just stress. I'm just getting older. There's nothing that I can do about it, is actually a consequence of an old injury that we didn't realize actually affected our neck. And so in this particular regard, it actually drives me insane when people have had x-rays or CTs or MRIs, different things like that, and the radiologist says, normal soft tissue, evidence of soft tissue damage, but everything else otherwise appears normal. It's like, that can be actually a very significant clue in terms of what's going on. Why? Because if that soft tissue damage is there, it means that it's going to have that accumulative effect affecting your muscles, your ligaments, and your nerves. And if it's your neck with those tethers that anchor onto your spinal cord, what that can do is that can have the physiological effect as if tugging on that piece of string. In other words, Chiari malformation is not always just associated with the problem with the skull, but that extra factor can be that something that's producing that tension on the string. And the tension on the string is what is actually producing those symptoms. And that's one of the reasons why, whether it's a whiplash, neck injury, concussion, all of those same symptoms, the headaches, the migraines, the vertigo, the dizziness, the chronic fatigue, the full body pain, the brain fog, all that sort of stuff, they are associated with the neck side of the equation and not exclusively the Chiari malformation in and of itself. So understanding that, it allows us, and it's important for people to realize, okay, whether or not you have been experiencing these symptoms, or if you've been diagnosed with the Chiari malformation, it's worth having a look at the structural alignment, motion stability of your neck to make sure that everything is the way that it's supposed to be. Because if it is, all right, that's good. If it isn't, that could very well be that source of tension that's actually producing those different kinds of symptoms. And so what I want to share with you guys here is the case again of a young woman who we took care of some years ago. And she had been diagnosed with a Chiari malformation. She already knew that this was going on, but she'd been experiencing essentially vestibular migraines, that is vertigo plus dizziness, plus brain fog, inability to concentrate for the better part of 10 years. And she had been persevering, doing the very best that she could under the circumstances, but of course it was making her life very, very difficult, not just work-wise, but then also her ability to enjoy the other things in life that she wanted to do. So she reached out to us and she said, okay, I've heard a little bit about, the particular type of work that you guys do where you're looking at head-neck alignment to see if that could be a contributing factor. And so what I want to do is I want to showcase for you what we saw, what we found, and what her outcome was. So that's what we're going to get into right now. So the first thing that we're going to start with are her MRI scans. And it's very unfortunate that her MRIs, they were done extremely tight. That is, We really weren't able to see many of the adjacent structures that we've commented on in other videos in terms of being able to see if there were disruptions of fluid flow either to the brain, from the brain, anything like that. But, it's like, okay, it gives us an opportunity to see what we have going on here. So what I'm going to do is I'm going to come to this particular slice right. Let's go with this one right here, because this one's going to illustrate a few of the things that we can point out in terms of what was going on. So what we've got here is she is looking this way. So this is forward. This is the back part of the neck. So this is a neck scan. So here's going to be the top vertebra in her neck. Here's the second one, third, fourth, fifth, sixth, seventh, and so forth and so forth. The dark things that we're seeing here, this is the neural tissue. So this is the brainstem right here. This is the spinal cord, which is just the extension. Think of it, if you would, as a brain tail. And then this right here is what's known as the cerebellum. It's the back part of your brain that processes all of the fine motor coordination. It's involved with reflex activation. It's involved with muscle tone. It's involved with fine motor coordinations, and it's also intimately connected with your vestibular ocular reflexes. In other words, it affects your eyes, it affects your hearing, and it affects your sense of balance. And you may or may not be able to see it abundantly clear. In fact, let me change the slice a little bit here. I'm going to go with a slightly different contrast. You know what? This one actually is going to work just a wee bit better. So it's going to be slightly different, but I think you can see the soft tissue all a little bit easier here. And we'll just slide that right there. So same thing again. Here's brainstem. Here's the spinal cord. It's this light gray all the way along here. Here's a cerebellum. Now, you'll notice that there is this white with the black around it. That is the back of her skull. So that's the bone. And then here then is kind of the front part of the skull. It's not really the front of the skull, but it's the part at the very front of the spinal canal, tucked, if you would, behind your jaw, behind your eyes, in that little area right there, because that's where your brainstem comes out and descends. So then here's that C1, here's that 2, 3, 4, 5, and so forth down. So what should normally be happening, as we said, you can imagine a balloon, piece of string attached to it. That balloon should normally be sitting inside of the cranial vault right through here. So what the Chiari malformation is where either A, the brainstem itself, or B, the cerebellar tonsils start to poke down. There we go, into the neurocanal right here. So this little bit that I'm showcasing right here should actually be sitting inside of the skull right there. And you can appreciate then, and in fact, I'll actually show you on another slice here. Fast forward a little bit. What we're looking at is a top-down slice through the top part of the neck. So here's where her C1, her C2 vertebra would be. Here's her spinal cord in the black, and then this would be the normal fluid around it. Now, what I'm going to do is I'm going to come up just a tiny little bit right here, because this is normally the level where you would expect to see all of that disappear. But you'll notice, so here's that spinal cord in the dark area right here. You'll notice that there is all of this stuff filling that whole space. In other words, what I'm saying is that all of that should be white. It should be fluid just like this, but you can see it's completely full of all of that stuff. And that's why I talk about and use the analogy of your foot is trying to fit into too tight of a shoe, because this then is going to be agitated and irritated to no end. Now, I throw this in here because this drives me nuts to no end, but in the same breath, I get it because they're just simply looking at it from a different perspective. When a radiologist is looking at a report, they're looking for overt signs of pathology, broken bones, tumors, infections, things that are going to kill you. They don't necessarily consider dysfunctional relationships. And so I'm looking at this, and here's what they say. They say there is low-lying tonsil on either side, but the appearance is unlike a peg-like tonsil. Peg-like tonsil is usually identified in the Chiari 1 malformation. In this evaluation, the tonsils lie about 6 to 7 millimeters below the Bayesian epistheon line, which is that base of the skull. Diagnostic criteria from a medical pathology standpoint is going to be about 5 millimeters, but you can still experience all of the same problems associated with the Chiari, even less than that. It's what's called a type 0 Chiari malformation. But anyway, here's the thing that they say. There doesn't seem to be any crowding at the level of the foramen magnum. Well, this is the level of the foramen magnum. This is the spinal cord right here, and this is all of the other stuff that is occupying that space. What they're looking at it is they're looking to say, okay, her spinal cord is not getting squished. Maybe that's true. However, look at the shape on that. That does not seem to me to be near as uniform as if we go down even that couple little slices right there, where it's nice ovular. That is not nice and ovular right there. I'm seeing, and I think that you are too, that wedge-like irritation through there. So point being is just because the report says that quote-unquote everything is normal, I always like looking at the pictures myself because I'm going to come up with a different conclusion based on that. So that's what we're seeing right here. There's this crowding effect that is going on. But again, to a certain degree, she already knew that. We knew that she had this cerebellar tonsillar ectopia. So there were 3 things then that we took additional notice on her scans, and this was before we even started doing any tests for her in the practice. The first one was the overall curve of her neck. So the curve of a person's neck should normally be a C shape, a nice smooth arc. When you lose that nice smooth arc, what that is evidence of a whiplash injury, but what it also means is you have that tethering kind of effect. Something is going to be pulling on that string, potentially producing different kinds of problems. And so guess what? As opposed to the curve of her neck being nice and smooth, it is this more subtle, too straight, subtle S shape going slightly backwards. And we can see that there is some evidence of physical damage that's occurred in her neck. And oftentimes this is put down as quote-unquote normal aging. I completely disagree with that. What this is this is common aging, but common because there was an old injury that was not necessarily identified. And again, here what we would have then is the accumulation days, weeks, months, years, decades, to where it can be slowly amassing and creating problems. So the first thing that we see is, yes, there's been some evidence of a neck injury. The second thing that we can notice here is that this dark shadow through here, which is her airway, it is quite too narrow, especially up through this area here at the level of the C1 and the C2 vertebra. Now, this can oftentimes be associated with a couple of things. Number one is a cranial or a TMJ issue. And I can tell you, because I did check, she did not have a TMJ issue. So we ruled that out. So the other possibility then that we have to consider is that something is going abnormally wrong with the normal neuromuscular control of the muscles that regulate the airway. And these then are going to be receiving their electrical or their innervation supply from the C1 and the C2 nerve roots. And so what we did is we had a look right up at the level of the C1 and the C2 just to see, is there any sign of distress in that area? And what we noticed, and this is oftentimes, considered to be a little bit of a variant of anatomy. Again, I disagree with that. But you'll see that there's this little bump thing right here, and then you'll see this little peg thing right here. This is the interface between the C1 and the C2 vertebra. And the edge right here should normally be in alignment like this. But what you might notice is instead of it being lined up like that, there's this little wedging effect going on like that. Now, this again, super common, but not necessarily normal. The C1 and the C2 vertebrae are the universal balancing account. When there is mechanical stress and strain from your neck or any part of your spine. In other words, the problem may not necessarily be coming from there, but your body uses that area to try to compensate for things. And if an area is trying to compensate for a long period of time, again, eventually, no matter how strong and resilient you are, eventually things are going to fatigue and things are going to show up. And so we're seeing that there is some evidence that that area is under stress and strain. So knowing all of that, what we did is we said, okay, we need to have a little bit more detailed look. And what we're going to do is what's called a digital articular X-ray. So whether it's an MRI, CT scan, or even standard X-rays, they're done from stock angles. However, we as human beings, we are three-dimensional. And we are different on the outside, the inside, also on the left and right sides of our body. In other words, everything is different. So in order to see what is actually going on, what we do is we make a few measurements so that we can find out what is your normal bone structure in the first place. And then we're going to take some detailed pictures from angles that you don't see even on an MRI so that we can find out what mechanically is going on in this area. Is there something that we can do to help out? So that's what we did next, and I'll show you what we found. Okay, now what this is called an oblique nasium or a Blair protracto view. And I do not expect you to know exactly what we're showcasing right here, but what we're doing is we're looking at an oblique slice so that we can look straight down and through along the joint margins where the skull meets the upper part of the neck. And any joint in your body, I don't care if it's in your low back, your neck, or your little toe, it should be neutrally lining up like this. When you see displacements, even by a couple of millimeters, that can be more than enough to produce neurological problems. That is, maybe not all at once, but if that's been slowly draining the bank account long period of time. And so what I've illustrated in the yellow right here, so this is going to be the right side of her neck where we're looking at the base of the skull right here sitting as it should be relative to the right side of the vertebra up at the top. In other words, everything looked completely normal. Awesome. This is what you'd want to see. The other side, though, a little bit different. And this is what we found on the other side. Amongst other things, she wasn't able to take out these particular piercings that she had. That's what this little white dangly thing is, nothing exotic. But what we found here is we found evidence that there was, in fact, a disrelationship between the vertebra at the top and between the skull. And this is not dislocated. This is not fractured. This is not unstable either. But these are the subtleties that even that couple of millimeters, if that joint is locked in that position orientation, that is that tethering kind of effect we're talking about, potentially pulling on the brainstem, pulling on that string, pulling the balloon down into the canal, and possibly be producing the very symptom that she is experiencing. So that is what we found. And what this represents is a very particular kind of misalignment where that vertebra had actually shifted and misaligned forward. Now, this was important because for her, she had already been to a number of different chiropractors, a number of different physical therapists, a number of massage therapists over the years, but unfortunately, she wasn't getting a breakthrough. Well, if you consider what most of those methods do, they're working on things of the spine, because the spine is a back-sided function. They're trying to release things from back to front. But what did we find? We found that her particular misalignment was front to back. And so what that means is it means that if we want to be able to provide, successful correction here for her, we need to make sure that any treatment we do is going to be tailored going front to back. And you don't have to go through the mouth or anything like that. You just have to change your angle. So odds are people had been working with her in the right area for a long period of time, but unfortunately, they were doing it from just a little bit of the wrong angle. So the fact that we were able to look on the inside, figure out exactly how do her joints fit together and figure out what's most appropriate for her, that was what we realized, okay, that's what we are going to be able to do and to offer differently. And so what we did is we proceeded to perform a correction for her based on what we found. And hers was a most remarkable result. As much as I would love to say, and what the goal always is, instant clear and wonderful and all that sort of stuff, when people have had issues going on for years or decades, even months, it can take a lot of amount of time just to reverse that negative momentum, let alone start going in the right direction again. General rule of thumb, and this is a good principle of any form of healthcare that you would ever do, you have got to give it a fair go for 6 to 12 weeks. If you're going longer than that, but you're not getting the right outcome, you could be doing the right thing, but the wrong order, like solving a combination lock. If, though, you haven't given it a fair go for that length in time, you haven't given it a fair go. Nevertheless, she described that she had almost an instant release of the pressure that she'd been experiencing all of that time. And over the next 6 to 12 weeks, what she was finding was that she was able to go a full day through work without her brain getting foggy, that she was able to not be completely wiped out at the end of the day, that she wasn't experiencing the migraines that she had always put down to the Chiari Malformation, that she was able to do the things at the end of the day on the weekend with her husband, with the pets, all that sort of stuff that she had wanted to do for such a terribly long time, but was just absolutely wiped out and not able to do. In other words, it was able to completely change her life without the drugs and the surgeries. So this is important for a couple reasons. Number one is it means that there is, for people, even if you do have the known Chiari malformation, there is potentially a third option that can help you. And this is what it is. Now, the other bit, and this is super important, is that the understanding that just because you may have the Chiari malformation does not necessarily mean that that in and of itself was what was creating the problem in the first place. So I come back to her MRI right here. No, we did not do pre and post MRI studies. There are some studies that have been done like that, but I didn't think that that would offer any particular value. But I'd be willing to bet that if we had done a post MRI, that she still would have been exhibiting this sign of this cerebellar ectopia. That is the Chiari malformation. The point being is that the fact that she was able to get the relief means that even though that was present, the fact that we were able to give her that much wiggle room, we were able to take the tension out of the system, her body was able to say effectively, thank you, we can deal with this on our own, even if that is there. In other words, a Chiari malformation is not necessarily condemnation, that there's nothing that you can do, that your life is going to be over, that it's going to have to be miserable for however long you're going to be living. In other words, there is hope. And so I hope that in, sharing her particular case, her story here, that it may be useful, be able to help, anybody out there watching this, so that you know that there is another way and that you can be improving the quality of your life. So there we go. Story of how a Blair upper cervical treatment was able to actually help a person with a Chiari malformation. Hopefully you have enjoyed this video. As always, what we ask you to do is, if you have, then please do, number one, like and subscribe to the channel here. That way it helps YouTube be able to recognize that this is a useful video so that other people looking for this kind of information are able to find it. Number two is, if you've got friends or family who you think, wow, they might really benefit from watching this, please do share this with them. And then number three is, if you want more information like that, go to our own website, which is drjeffreyhanna.com, where we've got links to all kinds of other videos, all kinds of other articles related to the big idea, how it is that this little problem up in the upper part of the neck can actually have very big consequences in terms of your health, healing, well-being, but in the same breath, how by resolving that can make a very, very big difference in terms of improving your overall quality of life. If you're in the Spokane area, we'd be delighted if you would reach out to us personally. That way we can find out what can we actually do to help you out. Go to Clear Chiropractic Spokane, where our team of upper cervical doctors are able to help you out. You can reach us at 509-315-8166. But if you're not in the area, then what we recommend you do is you go to blairchiropractic.com, and that way you can find a directory of doctors around the country and international so that you might be able to improve your quality of life that way as well. Thanks for watching this video. It's always a pleasure. I look forward to any feedback that you guys may be able to provide out there. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.